not yet.
Okay.
Bear with. Thank you.
Right.
Apologies, Chairman. We're now live.
Thank you very much. Good afternoon, everyone, and welcome to this meeting of the Bracknell Forest Local Outbreak Engagement Board, which is taking place on Zoom. And I'm grateful to you all for your attendance this afternoon. And with that, if I can ask Kirstine, please, if we have any apologies for absence.
Chair, I've received apologies from Fiona Slevin-Brown, Timothy Whedon and Elena Rozelle. As is sometimes the case, people can have problems accessing a digital meeting, so anybody who does not appear in the call will have their apologies recorded.
Thank you very much, Kirstine. Thank you. Right, so we come to the usual declarations of interest. If there are any disclosable pecuniary or affected interests, please disclose them now. And if there are none, and I can see no activity relating to that, then the usual caveat applies, please, that if any debate should take an unexpected turn and bring something up that is a disclosable pecuniary or affected interest, would anybody so affected please be happy to interrupt proceedings so that those interests can be recorded. With that, we'll move on next to the national and local COVID-19 status and roadmap update. And Charlotte, thanks very much. Over to you.
Thank you. I'll let Sabrina go through the data to start with, and then I'll pick up after with the roadmap.
Thank you, and welcome, Sabrina.
Hello, everyone. Let me just make my screen bigger. Sorry. Right. So
thank you.
As of today, so between the dates of 29th of April and 5th of May specimen dates, the case per 100,000 was 13.9. This is a 30% decrease on the week before. So it's actually gone up and back down again. So it looks similar to about 2 weeks ago. Looking at the 60 plus population, we've got a case rate of 8.1 per 100,000, which has gone down by 34% compared to the previous week. So we've actually had one case in the over 60s and 0 cases in over 65s. Looking at the case rate by age group, as you can see, in the 70s and overs, there's been no cases in the most recent week, but we do have one age between 60 to 70. Looking at lower age groups, we've got a few more cases in those aged between 10 to 14 and between those aged 25 to 29. Looking at case rate by ward, again, the numbers are small. We're looking at about 20 cases weekly now. However, we've got ever so slightly higher rates. It looks like in Harmons Water and Benfield and Warfield, we saw last week had slightly higher rates than the rest of the wards. Good news on deaths. We've had no deaths since 2nd of April. And actually, you may know that yesterday it was reported that we had no deaths nationally. So hopefully we can continue that trend. And looking at vaccinations, our 16 plus coverage is growing slowly. At the moment, it's at 58%. However, obviously for those older age groups, looking at 60 plus, 70 plus, we're at 90 to 93% coverage. Thank you very much.
Thanks very much indeed, Sabrina. Thank you.
Okay, and now I'll share my screen to go through the roadmap and the implications for Bracknell Forest. Okay, is everybody able to see the presentation? It should be showing.
Yes, we've got it. Thank you.
Lovely. So as was announced yesterday, the UK alert level has moved from a level 4 to a level 3. So while the COVID-19 epidemic is still in general circulation, transmission is no longer high or rising exponentially. And that means that there can be a gradual relaxing of the restrictions, and social distancing measures can now begin to be relaxed also. The 4 tests that the government looked to inform that decision to move to the next step, to step 3, review the vaccine deployment programme, and that continues to be done so successfully. The evidence looking at the vaccine to ensure that they're sufficiently effective in reducing severe illness, hospitalisation and death. And again, that's the case. And as Sabrina has mentioned, nationally, no deaths reported yesterday. And in terms of infection rate, looking at that infection rate to ensure that there's no surge ahead in terms of hospitalisations and putting unsustainable pressure on the NHS. And then finally, the risk assessment around those variants of concern. So it was obviously felt nationally that all of those tests were reached and the government were happy with those, and therefore the decision was made to move to step 3. So what does that mean in reality? If we look at the impact that it has on education, our schools and our colleges in Bracknell Forest will remain open for all students. The difference in this step is that universities will now be open to all students for face-to-face teaching with the introduction of twice weekly rapid testing for those students. And then the final point is that face coverings within the guidance is also being relaxed and not required within the classrooms by students or in the communal areas. And we'll be working with our schools, looking at their risk assessments and ensuring that locally that introductory guidance, it ensures that there's still COVID secure measures and safety in place within our schools. Then when we explore social contact, what does that mean? This is the biggest change from step 2. Outdoor gatherings are now permitted up to 30 people, and indoor gatherings are now permitted, limited to 6 people, the rule of 6, or 2 households, which also includes any support bubbles. So a bit like we're used to with outside space, in step 3, that's now permitted inside. And as mentioned, the outdoor gatherings has increased. The guidance moves away from being very prescriptive around what meeting friends and family looks like and moves towards more individual responsibility being applied in assessing what the risk is and then behaving accordingly. So individuals are encouraged to consider their specific risks of transmission. They might want to consider the vulnerability of the individuals that they're meeting, whether or not they've been vaccinated, and also where you're meeting, whether you're indoors or outdoors. There is a risk. The closer the contact, that does increase the risk of transmission, but it's an informed decision that the government are encouraging individuals to make in making that closer contact. In terms of social contact, hands, face and space still remains in place, even for those who have been vaccinated. This is really key because we know that whilst vaccination does protect the individual from severe illness, and the emerging evidence would suggest that there's also a protective element around transmission, it doesn't eliminate it. And so that means that even when you're vaccinated, you can still pick up the virus and you can still pass it on. So at the time being, the hands, face and space and fresh air remains in place for all individuals. And there will be a wider social distancing review towards the end of the month prior to the 21st of June. So that will review the need for social distancing more broadly. And whilst that's pending, with step 3, it's still advised that if you can work from home, you continue to do so. Support groups and parents and children groups, their gathering limits are increasing up to 30 people, and that doesn't include the under 5s. So that means that those social groups can increase in size. And in terms of our care home residents and individuals living within a care setting, the visiting and receiving of visitors will change. So those individuals will now be allowed up to 5 named visitors, 2 at any one time, providing that visitors test negative for COVID. And that testing process is already in place for the 2 individuals that are currently permitted. Self-isolation will no longer be required for individuals living within a care home setting. For instance, when they visit GPs, dentists, day centres, they have any outdoor visits to parks, etc., or if they attend any educational settings or work settings, when they return to the home, they will no longer be required to self-isolate. And visits to those homes will only pause for the minimum of 14 days rather than 28 days following an outbreak, providing there's no variants of concern associated with that outbreak. So that gives much more freedom to individuals who are residing in a care home setting. When we look at our business and activities across the borough, again, a big change with this step. Indoor entertainment and attractions such as cinemas, theatres, concert halls, bowling alleys, casinos, amusement arcades, museums and children's soft play areas will be permitted to open as long as COVID secure measures are in place. And obviously that we still have to consider the social contact rules in terms of the rule of 6 or 2 households meeting together indoors. Indoor hospitality venues such as restaurants, pubs, bars, cafes can also reopen, but again, the waiter service to table still needs to be in place. Organised outdoor sports will be able to take place for all. That includes gym classes, and this must be organised by a business or charity or public body. So meaning that can't be an informal arrangement by the general public. All holiday accommodation will be open. That includes hotels and bed and breakfasts. And this again can be used by groups of up to 6 people or 2 households. So again, applying those social contact indoor rules in those settings. When we consider travel, there'll no longer be a legal restriction or permitted reason required to travel internationally. As we know, there's been the introduction of the traffic light system for international travel. The full rules around travel are noted on the gov.uk website. But we have a red, amber and green list of countries. The red list advises not to travel for leisure purposes and to only visit in extreme circumstances, and only permits British or Irish nationals to enter back into the UK as long as they adhere to strict testing and quarantine measures. The amber list is similar, so again doesn't advise any travel for leisure purposes, but does permit individuals who aren't British or Irish nationals to return to England, and again will require strict testing and quarantine measures. It's only the green list where testing is required, but quarantine is not required. And that list of countries is fairly limited as it stands. We understand that those lists will be reviewed every week, and there will, as long as it allows, be time and notice given when countries move from one list to another, but that can't be guaranteed. In addition, domestic overnight stays will be permitted, but still advising to limit travel that's not necessary. And then finally, the events. Again, people will be able to attend indoor and outdoor events now. That includes live performances, sporting events and business events. Attendance at the events will be capped according to the venue type to ensure COVID secure measures can be applied effectively. Funeral attendance will no longer be limited to 30 people. However, it will be determined by the capacity of the venue and how many individuals they can safely accommodate with social distancing applied. So whilst that's still the case, that's the limiting factor really, particularly locally with some of our venues, opposed to the 30 people limit. And then limits for weddings, wakes and other commemorative events will be also increased to 30. But as mentioned before, that really does, it's the venue's capacity size that's the limiting factor. Other significant life events such as bar mitzvahs and christenings will also be able to take place with 30 people. And so this step will come into play on Monday, on the 17th of May, and we will continue to adhere to those revised restrictions here locally. Step 4, that final step of the roadmap, will be reviewed at the end of the month and won't be implemented before the 21st of June. And I just wanted to also take the time to say, with the restrictions easing, rapid testing and vaccination will become even more important within Bracknell Forest in order to keep the rates that Sabrina's just presented low. It's now being encouraged and advised by the government that all individuals aged, secondary school aged and over, to test twice a week using the lateral flow test. This is for individuals with no symptoms. So if you do have COVID symptoms, you should still be continuing to arrange the normal PCR testing as has been in place for the entire pandemic. This is an introduction more recently. We've been rolling out lateral flow tests within the community since February, but we're now advising every single individual secondary school aged and over should be testing twice a week. And this is because we know that 1 in 3 of those who are carrying the virus do so with no symptoms at all. The testing, therefore, will help us identify cases that we wouldn't normally know about, and as long as they self-isolate, will prevent any onward transmission, will prevent them from unknowingly transmitting the virus to others. And by doing that, that will keep our rates low. Now, we know that the lateral flow tests aren't as accurate as the gold standard PCR tests. However, they're better than not testing at all. The idea of these tests, that they allow the entire population to test, they turn around the results rapidly within a 30-minute period, and they don't put unsustainable pressure on the laboratory services. What they do is they enable us to identify cases that we wouldn't have known about otherwise, and therefore we break that transmission. The risk of the test not picking up a case is counteracted by the important guidance that everyone should continue to follow hands, face and space and fresh air and the other restrictions, regardless of the test result. So that mitigates against that risk. In addition, the risk of the test falsely identifying a case when in fact they haven't got the virus is counteracted by the fact that any positive case identified by one of these lateral flow tests should have a confirmatory PCR test to ensure that they're positive. And the slide that I'm presenting just clearly demonstrates if you have symptoms or if you don't have symptoms, who should be accessing testing and then where they can get those tests from. And we, more information is, I've noted here, available on our Bracknell Forest Rapid Testing COVID-19 website. That lists all of the local test sites that we've got available. We also offer the Community Collect, where you can collect tests to do home testing from those sites. And now every single one of our pharmacies in the borough also offers the pharmacy collect to collect tests and take them home and test twice weekly at home. And you can also order online through the gov.uk website and then get those tests posted to home. So it's extremely accessible to get the tests. Once you do that test, if it's negative, you don't need to isolate, but as I've mentioned, it's still important to follow those hands, face, space and fresh air guidelines. If it's positive, you should isolate immediately and do so for 10 days, and your household should also isolate too. You're then advised that you should arrange a PCR confirmatory test, and if that test remains positive, you continue to complete that isolation period. If that test comes back as negative, then the isolation is lifted and you can carry on as per normal. So that's the process, and it's extremely important to then record those results on the gov.uk website, which is the last link that I've noted there. Again, to give us insight into how the rates are doing locally and regionally and nationally, but also to give us insight as to the accuracy of the lateral flow test. So again, I'd stress that. So just to recap, really, the testing, self-isolation and vaccination will continue to enable us to ease the restrictions. And I can't stress their importance enough, really, and really encourage all to start engaging in the programme if you're not already doing so. And I'll stop there.
Thanks very much indeed, Charlotte. Thank you. At this point, I just ask, does anybody have any questions for Charlotte on that? No? Well, thank you, Charlotte. That was a very clear report and some very useful information there. Thank you. We'll now move on to agenda item 5, which is the communication and engagement update at both national and local level. And that's going to be introduced for us today by Abby Thomas. Thanks, Abby.
Thank you, Chair. Just sharing my screen. Can everybody see that?
Yep.
Okay, sorry, just trying to bring it up onto slideshow. Okay, doesn't appear to be displaying on slideshow, but if that's large enough for everyone, I'll present from here. So in terms of our communication priorities, testing and vaccination promotion continues to be right at the top of our agenda. So we're continuing to promote how to get tested and why it's important, and also continuing to promote who's eligible to be vaccinated and how many people in the borough have been vaccinated, as well as doing a significant amount of work on myth busting around the vaccination programme. As Charlotte has just mentioned, we're also continuing to reinforce the importance of hands, face, space, isolate and ventilate, and weaving this into the messaging as well. And obviously in the context of the national steer is that this needs to continue despite the changes to personal contact, which were announced by the Prime Minister last night. So really, as Charlotte said, encouraging people to take an informed decision and individual responsibility in assessing risk. Okay, so my slides have frozen. Sorry, let me just try and move them on here. In terms of the step 3 in the roadmap, the Prime Minister's announcement last night set out those steps clearly, and Charlotte's just talked to that in detail. We're signposting the new rules, especially around close contact and meeting indoors, and ensuring that our messages are really stressing that people do need to remain vigilant, follow the hands, face, space message, and encouraging people to now regularly make sure that they're testing twice a week and that they're signing up to be vaccinated when they're invited to do so. We're also thanking residents for all of the support and just the huge commitment that everyone's given to following the rules up to this point, which has led to significant progress in terms of reduction in the rates. We're also providing information on how to celebrate significant cultural festivals like Eid and Shavuot within the restrictions, and significant work going on that over the next couple of weeks. Two final areas to mention, self-isolation and mental health. In terms of self-isolation, we're increasing promotion to ensure that people know how and why they must self-isolate, and rolling out some further marketing work into our communities on that, and targeting some of the comms at particular age groups and audiences via digital channels. And finally, we're working closely with colleagues within the clinical commissioning group to help promote what mental health support is available for both adults and children, and ramping up promotion of this, particularly to coincide with Mental Health Awareness Week, which is coming up shortly. So I think that gives an overview on current priorities, but very happy to pick up any questions that anybody might have.
Thanks very much, Abby. Thank you. Colleagues, are there any questions for Abby? No? Okay. Well, thanks very much indeed, Abby. That's great to have the update. We now move to agenda item 6, which is the area for public participation. And at this point, I'd like to ask Kirstine if we have any questions from members of the public.
Chair, I'm not aware of any questions that have been submitted to the committee Dropbox in advance of the meeting.
Okay, fine, thank you. Then we need to review by exception the outbreak log and the revised, we have to agree a revised meeting schedule. So Kirstine, I believe that's probably back to you.
Yes, Chair, the papers for the new meeting schedule are on page 11 of the agenda, and unless any board members have anything to add to the action log, the only items that are outstanding are all board members to notify the board of any false or fake news so that it can be addressed and countered with accurate information. All board members to provide Elena and the comms team with contact details of anyone who'd be willing to share their COVID-19 story as a case study about how COVID-19 has affected them, and Charlotte to seek clarification on the South African variant and the impact on Bracknell Forest.
Okay, fine, thank you very much. So if we're all content on that, and it certainly would appear so, then that concludes the business of today's meeting. Our next meeting is scheduled for the 15th of June. And I look forward to seeing you all then, if not before. And I once again thank you all for your attendance today and wish you a good rest of the day. Thanks very much indeed.